A quiet review that could reshape SSI and SSDI payments. Listen very carefully because what you are about to hear is not a rumor, not a headline exaggeration, and not a confirmed payout. It is something far more important. Behind closed doors, inside the Social Security Administration and the Office of Retirement Policy, officials are quietly reviewing a proposal that could fundamentally change how SSI and SSDI benefits are paid in the future. This is not a simple cost of living adjustment. This is not a routine annual increase. This is a structural review, the kind that only happens when the existing system is no longer working. According to internal discussions referenced in recent briefing materials, analysts are studying a two-tier benefit model that would establish two new monthly payment levels for certain SSI and SSDI recipients. One tier centers around $1,200 per month. The second tier reaches approximately $1,800 per month. And if this model ever moves beyond review and into formal proposals, it would represent one of the most significant shifts in disability and low-income benefits in over 2 decades. Now, let's be absolutely clear from the beginning. Nothing has been approved. No checks are being issued. No enrollment has begun. But when Social Security uses words like review, modeling, and structural framework, those words carry weight. They signal that lawmakers and policy experts are actively searching for solutions because the current formulas are under serious pressure. For millions of Americans on SSI and SSDI, that pressure is already very real. Right now, many SSI recipients are still receiving $700 to $800 per month. Some SSDI beneficiaries receive payments that barely reach $900 or $1,000. Those numbers may have worked decades ago. They do not work in today's economy. Food costs more, housing costs more, utilities, insurance, and medical expenses continue to rise. And while cost of living adjustments exist, they have not kept pace with real-world expenses, especially for seniors and people with disabilities living on fixed incomes. That is the backdrop for why this review is happening now. Earlier this year, a bipartisan policy review group quietly asked both the Social Security Administration and the Congressional Budget Office to explore alternatives to the existing benefit structure. The question they posed was simple but powerful. Is there a way to stabilize SSI and SSDI payments so that the lowest income and most vulnerable Americans are not permanently trapped below the poverty line? The answer they are now exploring is a dual-tier benefit system. Under this approach, benefits would no longer rely solely on outdated formulas designed for a very different economy. Instead, payments would be reorganized into clearer levels that better reflect modern living costs and long-term hardship. That is why this proposal matters. Because when Social Security begins evaluating entirely new payment frameworks, it means leaders recognize that minor adjustments are no longer enough. The system itself may need to be modernized. And that brings us to the most important question of all. Who would these tiers be for, and how would they work in practice? That is exactly what we will break down next. The $1,200 baseline tier, why Social Security is rethinking the floor. To understand why the $1,200 baseline tier is at the center of this review, we need to start with an uncomfortable truth. The current SSI and SSDI payment floors are no longer aligned with reality. For millions of Americans, especially seniors and people with disabilities, monthly checks were never meant to provide luxury. They were meant to cover basic survival, food, shelter, utilities, and essential medical needs. But today, those basics cost far more than they did when many of these formulas were created. Right now, the federal SSI maximum remains far below what most experts consider a livable income. Many recipients still receive between $700 and $800 per month. Even when combined with limited state supplements, that amount barely stretches through the month. This is exactly why analysts inside the Social Security Administration are revisiting the concept of a baseline payment floor. The proposed $1,200 tier is not designed as a bonus. It is designed as a foundation. In early review discussions, the $1,200 figure is being used as a reference point, a modernized minimum level that better reflects today's cost of living. Analysts describe it as a corrective adjustment, not an expansion of benefits beyond necessity. In simple terms, the baseline tier aims to answer one question. What is the minimum monthly amount required for someone on SSI or low SSDI to maintain basic stability in today's economy? Under the current system, many recipients fall far below that threshold even after annual cost of living adjustments, and that gap has grown wider over time. One reason is that COLA increases are based on broad inflation measurements that do not always reflect the spending patterns of seniors and people with disabilities. Medical expenses, housing costs, and utility bills often rise faster than the inflation index used for adjustments. As a result, benefits increase on paper, but purchasing power continues to shrink. The $1,200 baseline tier is intended to reset that shrinking floor. For SSI recipients, this tier could effectively replace the outdated federal maximum with a more realistic standard. For SSDI beneficiaries whose payments fall below $1,200 due to limited work history or low lifetime earnings, the baseline tier could act as a lift, bringing their payments up to a level analysts consider minimally sustainable. Importantly, this tier is not tied to new work requirements. It is not a reward for recent employment. Instead, it recognizes a reality many policymakers now acknowledge: people on long-term disability or SSI are not falling behind because they failed to work harder. They are falling behind because the system has not kept up. Another critical element of the baseline tier is predictability. Right now, many recipients rely on a patchwork of assistance programs, food aid, housing support, emergency relief, because their Social Security check alone is insufficient. That creates instability, delays, and administrative complexity. By strengthening the baseline Social Security payment, analysts believe fewer people would need to rely on crisis-based assistance programs. That stability benefits recipients and reduces pressure on other safety net systems. And this is where the conversation becomes more serious. Early modeling suggests that raising the floor within Social Security could actually reduce spending elsewhere, particularly in emergency assistance, Medicaid-related hardship costs, and short-term aid programs triggered by financial crises. In other words, the baseline tier is not just about increasing checks, it is about preventing deeper poverty before it starts. But here's what matters most. The $1,200 tier is only the starting point. Because while this baseline could help millions, analysts recognize that some individuals face challenges far beyond what a single floor can address. That realization leads directly to the second tier, the one generating the most attention, the $1,800 enhanced tier, who it's really designed for. While the $1,200 baseline tier focuses on restoring a livable minimum, the $1,800 enhanced tier addresses a deeper and more complex reality: long-term hardship that the current system has never fully recognized. This second tier is not about short-term need, it is about lifelong impact. According to early review discussions, analysts inside the Social Security Administration acknowledge that not all SSI and SSDI recipients face the same challenges. Some individuals live with disabilities or financial limitations that began early in life and followed them for decades. Under today's system, those individuals are often treated the same as someone whose disability occurred later or whose work history allowed for higher benefit calculations. The enhanced tier is an attempt to correct that imbalance. The $1,800 level is being studied as a support tier for people whose circumstances place them at exceptionally high financial risk, even by SSI and SSDI standards. So who is this tier really for? First, individuals with long-term disabilities. Analysts are examining whether disability duration should play a greater role in determining benefit levels. Early indications suggest that people disabled for 5 years or more may face compounding financial pressure. Medical costs rise, work opportunities shrink, and savings disappear. Second, individuals with lifelong or early onset conditions. This includes adults whose disabilities began before age 22, often referred to as adult disabled children. These individuals may have never had the opportunity to build meaningful work credits, not because of choice, but because their medical conditions made employment impossible from the start. Under the enhanced tier model, these cases would no longer be treated as marginal. They would be recognized as structurally vulnerable, deserving of stronger permanent support. Third, individuals with extremely low lifetime earnings. The SSA uses a metric called average indexed monthly earnings to calculate SSDI benefits. For many people with disabilities, that number is low because earnings were interrupted repeatedly by medical conditions. Early review notes suggest that individuals with very low lifetime earnings, especially when paired with long disability duration, could qualify automatically for the enhanced tier. Fourth, people with multiple hardship indicators. This is where the review becomes more modern and nuanced. Analysts are discussing a system of hardship markers that go beyond income alone. These could include long-term reliance on SSI, lack of family support, severe medical expenses, or prolonged periods of documented poverty. Instead of forcing individuals to fit into outdated categories, the enhanced tier would allow the system to respond to real-world conditions. One of the most significant aspects of the enhanced tier is flexibility. Early discussions suggest that the $1,800 level may not always function as a flat replacement. In some cases, it could act as a top-up. For example, someone already receiving $1,400 in SSDI might be elevated to $1,800 if they meet enhanced eligibility criteria. This represents a shift in thinking from rigid formulas to adaptive support, and it's important to understand why this tier exists at all. Policymakers and analysts are increasingly aware that extreme financial stress leads to higher long-term costs, emergency medical care, housing instability, and dependence on multiple assistance programs. The enhanced tier is designed to intervene earlier, stabilizing lives before crises occur. But here's the key point. This tier is still under review. No one has been approved. No dollar amount is guaranteed. However, the fact that the SSA is seriously modeling an enhanced tier tells us something important. Leaders now recognize that a one-size-fits-all approach to disability benefits is no longer sufficient, and that brings us to the next critical group, those who fall between systems, concurrent beneficiaries, and the problem the system never fixed. There is a group of Americans within Social Security that is often overlooked, misunderstood, and quietly struggling more than almost anyone else. They are known as concurrent beneficiaries, people who receive both SSI and SSDI at the same time. On paper, this might sound like double support. In reality, it usually means double hardship. Most concurrent beneficiaries receive a very small SSDI payment due to limited work history, often caused by early or long-term disability. SSI then steps in to fill part of the gap. But even when combined, these two payments often leave individuals below the federal poverty line. This is one of the clearest signs that the current system is fragmented. SSI and SSDI were created under different rules, different formulas, and different assumptions. Over time, that separation has created duplication, complexity, and gaps, especially for people whose lives do not fit neatly into one category. The dual-tier benefit model directly addresses this problem. Under early review concepts, concurrent beneficiaries would no longer be forced to navigate two overlapping systems. Instead of stacking two small checks, individuals could be assigned one unified benefit level based on their actual circumstances. For many concurrent beneficiaries, that unified level could fall under the enhanced $1,800 tier. Why? Because this group often meets multiple hardship markers at the same time. Long disability duration, low lifetime earnings, limited work capacity, heavy reliance on SSI, high medical needs, minimal financial support networks. In other words, concurrent beneficiaries represent exactly the kind of long-term vulnerability the enhanced tier was designed to address. Early modeling suggests that simplifying benefits for this group could produce two major benefits at once. First, it could significantly increase monthly support, offering a more stable and predictable income. Second, it could reduce administrative complexity, fewer calculations, fewer adjustments, fewer delays. That matters more than most people realize. Right now, many concurrent beneficiaries face frequent payment recalculations, reporting requirements, and confusing adjustments. Even small changes in income or living arrangements can trigger paperwork, delays, or overpayment notices. A unified benefit structure could reduce those disruptions and give recipients something they rarely experience: financial consistency. Another important group affected by this review includes low-income seniors who fall into coverage gaps. Some seniors do not qualify for full SSDI because of limited work history. Others receive Social Security retirement benefits that are too low to support basic living costs, but do not qualify for SSI due to technical eligibility rules. The dual-tier review is examining whether the baseline and enhanced tiers could help close these gaps, particularly for seniors living alone with limited resources. This is a quiet but meaningful shift. For decades, benefit structures have been shaped around categories rather than outcomes. The current review reflects a growing recognition that outcomes matter more than labels. Can someone afford food, housing, utilities, and medical care? Can they live with dignity and stability? Those questions are increasingly guiding the discussion. But with all of this potential comes an important reality check. Nothing moves forward without cost analysis. Can Social Security afford this? What the cost models are showing. Whenever numbers like 1,200 or 1,800 begin circulating, the first question lawmakers ask is not emotional, it is mathematical. Can the system afford it? That is exactly why the Congressional Budget Office and Social Security analysts are deeply involved in this review. Any structural change to SSI or SSDI must survive intense scrutiny, not only politically, but financially. What makes this review different is that it is not being framed as a simple spending increase. It is being evaluated as a cost-neutral or cost-rebalancing model. In other words, analysts are asking whether strengthening Social Security benefits could reduce spending in other areas of the federal budget, and early results have surprised many observers. Initial modeling suggests that raising baseline and enhanced benefits may lower long-term costs associated with poverty-driven programs. These include emergency housing assistance, crisis food support, and Medicaid expenses linked to untreated medical and financial instability. Think about it this way: when people can pay rent, keep the lights on, and afford basic food, they are less likely to experience emergencies that trigger expensive government interventions. Stable income often leads to better health outcomes, fewer hospital visits, and reduced reliance on short-term aid. This is not theory, it is data-driven policy analysis. Another important factor is administrative efficiency. Right now, SSI and SSDI operate under separate systems with different eligibility rules, calculations, and reporting requirements. This creates duplication, delays, and costly administrative overhead. The dual-tier model offers an opportunity to simplify those processes, especially for concurrent beneficiaries. Fewer moving parts mean fewer errors, fewer appeals, and fewer costly reviews. That simplification has real dollar value, but cost is not the only concern. Analysts are also studying long-term feasibility. A dual-tier system requires updated eligibility tools, modernized data systems, and clear guidance for millions of recipients. These changes take time and investment. However, internal review notes suggest the SSA has already begun testing digital verification tools designed to speed up eligibility assessments and reduce delays. That detail matters. It suggests the agency is not just theorizing about change, it is quietly preparing its infrastructure in case reform moves forward. Still, no proposal survives without political review. Lawmakers want to know whether this model can remain stable across economic cycles. Can it function during recessions? Can it adapt to demographic shifts as the population ages? These questions are now part of the analysis, and here is something critical to understand. This review is happening because the current system is already under strain. Rising poverty among seniors and people with disabilities creates hidden costs that do not disappear. They simply move to different parts of the budget. The dual-tier model is being evaluated as a way to address those pressures at the source, but none of this happens overnight. The review process includes projections, scoring, internal reports, and ultimately, public debate. That is why the next phase is so important. What happens next? Timelines, scams, and what you should do now. After everything we have broken down so far, one question remains more important than all the others. What happens next? Right now, the dual-tier benefit concept is still in the review and modeling phase. Analysts inside the Social Security Administration, the Congressional Budget Office, and a small bipartisan policy group are evaluating whether this idea is financially workable, legally sound, and politically realistic. That process takes time. Based on how major Social Security changes have unfolded in the past, the next 60 to 90 days are critical. This is when internal reports are finalized and recommendations are either advanced or quietly shelved. If the data supports the proposal, lawmakers could begin discussing the dual-tier model publicly as part of an upcoming budget cycle. That does not mean immediate approval. It means debate, hearings, revisions, and negotiations. In short, movement, but not money. That distinction matters because whenever big numbers start circulating, misinformation follows. Let's be absolutely clear. No one is being approved today. No one is being enrolled. No fees are being charged. No special forms are required. Anyone claiming otherwise is not connected to the Social Security Administration. Scammers often target seniors and people with disabilities by exploiting uncertainty. They may promise early access, guaranteed payments, or fast-track approval. These claims are false. The SSA does not notify beneficiaries through random calls, emails, or text messages about new programs in development. All legitimate updates come through official channels. So what should you do right now? First, stay informed, but cautious. Follow updates from trusted sources, not viral headlines or social media rumors. Second, review your current benefit information. Make sure your SSA records are accurate, especially regarding disability onset dates, work history, and income reporting. These details matter if eligibility rules ever change in the future. Third, be patient. Major Social Security reforms move slowly for a reason. They affect millions of people, involve billions of dollars, and must withstand intense scrutiny. But here is the most important takeaway. The fact that this review is happening at all tells us something significant. For the first time in many years, policymakers are not just adjusting numbers, they are questioning whether the entire structure of SSI and SSDI still works for today's economy. That is not a small shift. For decades, seniors and people with disabilities have been asked to survive on benefits designed for a world that no longer exists. This review reflects growing recognition that dignity, stability, and fairness require more than incremental adjustments. Whether the dual-tier model becomes reality or not, the conversation itself marks a turning point. It means your challenges are being acknowledged. It means your voices are being heard, and it means pressure for meaningful reform is building. As always, the best protection is information. Stay alert, stay skeptical of promises that sound too good to be true, and stay engaged because the future of Social Security is being shaped right now. One review, one analysis, one decision at a time. Your benefits matter, your stability matters, and your future deserves careful attention.